There are many ways, and among them international surveys, to measure the performance of healthcare systems. One of these is called the Euro Health Consumer Index, which comprises 35 European countries and assesses their healthcare system performance along 49 indicators grouped into 6 dimensions: patient rights, accessibility, outcomes, range and reach of services provided, prevention, and pharmaceutical care. Each country has calculated a score in each dimension, and these dimension scores are aggregated into overall scores. Healthcare system performance can be green, yellow, and red based on the overall score achieved by the country. As you can see in the chart on the left of this slide, most Central European countries are red. It can also be seen that green countries are typically located in Scandinavia and Western Europe. This slide shows the full ranking of the 35 assessed countries in 2016. The Netherlands have the highest overall score, 927 points out of a maximum of 1,000, closely followed by Switzerland, Norway, Belgium, and then Iceland. The lowest performers were Central and Eastern European countries, without any exceptions. Of all European Union member states, Romania and Bulgaria ranked the 2 last, but Poland and Hungary do not have much higher scores either. On this scale, other Central European EU member states, most prominently Slovenia, Estonia, and the Czech Republic, show a much better performance. It is often asked if healthcare investments can be corroborated by healthcare outcomes. Based on the Euro Health Consumer Index survey, the answer is yes. This correlation is illustrated in this slide. The map on the right of this slide shows the performance of the assessed countries in the outcomes dimension. As you may note, the color patterns are similar to the colors of the map which showed the overall scores. However, there are some differences. Some countries with yellow overall performance offer green outcomes to their citizens. However, other yellow countries, typically from Central and Eastern Europe, have red outcomes too. This means that the healthcare system is not really able to convert efforts and interventions into tangible results. In such cases, there may be organization issues in the background. The chart on the left side of this slide shows the correlation between per capita healthcare expenditure expressed in US dollars and charted on the horizontal axis, and health outcomes scores charted on the vertical axis. Green dots are individual countries. The relationship is clear. The more a society invests into healthcare, the better outcomes it can expect. Finland and Iceland are highlighted as top performers in this regard. Waiting lists are often mentioned as key performance indicators from a patient perspective. Actually, waiting lists cause problems across all Europe, and it would not be appropriate to say that they are a problem of Central and Eastern Europe. Portugal, Spain, Ireland, the UK, and Sweden are all red as regards waiting lists, and this indicator is a main cause of their overall yellow rather than green ranking. The Euro Health Consumer Index has also pointed out that there is no correlation between per capita healthcare spending and accessibility. It is therefore not true that poorer countries should have longer waiting lists. Rather, wait times seem to be more associated with demand control and some probably outdated health policies. For a conclusion, we are not jumping to the findings of the Health at a Glance survey conducted by the OECD. Its results regarding life expectancy at birth and mortality rates confirm that better healthcare systems generally offer better health perspectives for citizens. This is true even though life expectancy is clearly correlated with factors which are outside the healthcare system, such as lifestyle and the role of the broader social net on which people can rely for support and help. These factors are likely to play a significant role in Southern Europe.